Welcome back to Zanmi Lasante's Sante Lakay podcast, where we sit down with those on the front lines in healthcare in Haiti. I'm your host, Corleen Noisette, the Director of Development for ZL. Today, we are joined by Dr. Ornella Sainterant, who is ZL's Divisional Director of Training and Development, as well as Dr. Fritz Vernet, who is an internal medicine specialist and Director of Medical Education. They will be sharing insights on ZL's robust medical education program. However, before we get started, I would like to give them the opportunity to share a little introduction about themselves to the audience. So over to you.
Thank you, Kwale. It's a pleasure to be here. I'm Fritz Vernet, and I currently serve as the Director of Medical Education at Zanmi Lasante. My journey with ZL began in 2015 as a social service resident. In 2016, after going through the highly competitive entrance exam, I joined the internal medicine residency program at Hôpital Universitaire de Mirvalais. I completed the 3-year program as chief resident, and right after graduation, I became part of the core faculty. Since then, I serve as the coordinator for the renal program, then as program director of internal medicine for 3 years, and now I have the honor of leading our broader medical education efforts. And I'm really looking forward to today's conversation with you and Dr. Sainterant to reflect on how far we've come and where we are headed in training the next generation of Haitian specialists. Thank you for having me.
Thank you. It's quite impressive. Over to you.
Good afternoon, everyone. Good afternoon, Kwale and Vernet. Thank you for having us for this discussion around medical education in Haiti and ZL. My name is Ornella Sainterant, and I'm a family physician and trained also in palliative care and medical education. So my role in ZL right now is Divisional Director for Training and Development, Professional Development. I joined ZL in 2010 as a social service resident, and then in 2012, in the first cohort of ZL residency program in family medicine. And afterward, I started working from 2015 to now from the coordinator of clerkship, clinical clerkship, to continuing education and medical education director, and since 2 years as a divisional director for training and professional development. So it's a pleasure to be with you and to share about our journey, the ZL journey in medical education.
Thank you so much. It's great to have an alum of the program share their unique perspective. So to begin, I think our audience would be grateful if you could walk us through the origins of ZL's medical education program and the vision behind it.
We can say that Zanmi Lasante's medical education found its origin with our late Dr. Paul Farmer's vision and about what we call global health, social justice and equity. So when they start ZL as a health facilities who provided care to the most vulnerable ones, in tuberculosis and HIV, they kind of start like training for the providers. And after the 2010 earthquake in Haiti, we lost a lot of our health provider. So the ideas of, okay, why not go our network, not only in providing care, but also train you and the best quality of professional that we can have in the world. And this is the idea that we have behind HUM, the Hôpital Universitaire of Mirvalais, and the residency program. So in 2011, they start partnership with the State School of Medicine and Pharmacy and the Harvard Medical School to open the first ever residency program for the ZL network and the second residency program in family medicine in Haiti at the Saint Nicolas Hospital in Saint Mark. And they opened at HUM, Hôpital Universitaire de Mirvalais, in June 2013, and start 3 other programs: the internal medicine, pediatrics, and surgery on October 2013. And from this day, for our day, we have now um, 10 residency programs. So we in a one fellowship program. So we not only train physicians, but also we train nurses in nurse anesthesia and as well as nurse practitioner in emergency also. So we can say that it's if we look at the statistic that we have in our country, we have less than one health provider for 1,000 population, 1,000 people. This is quite less than what we can have in our population, and it's getting fewer right now. The current high rate of injury that we have in the country. So train a professional in specialized care. It's really important for our country right now, and I can say that we not only try to train the professional, the healthcare professional in the best practice that we can have in the standard that we have in the world, but also we base our training in on social justice, aka social medicine, and and as well as the capacity to lead the community, the capacity to understand the community, to go for to advocate for this community. This is what we are doing in all of our residency program at ZIA.
Thank you so much. So, building upon that foundation, what would you say has been the most significant and meaningful impact of the program on healthcare delivery in Haiti?
The first thing that I can say it's before 2021 we had 98% of our alumni staying in the country and working, not working in power plants in the big city, big capital, but working in most of the remote part of the country, working at Ballet, working at Kaj, at Enche, at Belader, even at Lakay or in Jeremy, Kepetion. Anywhere in the country, you can find like one of our alumni working as a leader in the community. But since we start having security issues in the country, we have this decrease around 70% of health professionals staying in the country right now, training at HU. And so we can say that one of the biggest strength that we have is the leading the fact that all alumni the same, they stay in the country to work and they stay in the rural part of the country to work. And the other impact that we have, it's that model that we go um in medical education, having other people think about what we were doing, we want to do the same. And this is the same thing that we have like in the public sector. We have discussion with them, what they can implement, what they can do as the same, for example, or recruitment process. So they want to learn about what we are doing and how they can implement it. And the other impact that we had is the fact that we were able to work through accreditation, getting institutional accreditation, and getting to three of our program accredited. Institutional accreditation for HUM, that means that HUM is recognized as um, one of the hospital in Haiti that can give. I can say the only one that get that in the country, and the only one in the Caribbean. We can say that as well, getting that accreditation that say that we have the best standard of practice. So we train all professionals within the best standard of practice that we can have. And we also have, we obtained that in 2019, and in 2023, we had three of our programs, the internal medicine program, family medicine, and emergency medicine. We, they get the accreditation, program accreditation, initial accreditation. And we renewed our accreditation throughout the years with H1, and now we are working on renewing the program accreditation as well. And the other impact that we can say we have, it's this idea of like having people that would train, staying in the country and be the one who train the other generation. And when I started, we had other people to train us. And now I can say that we can say I was one of the graduates from ZL residency program. Dr. Vernet was one as well. So we are now leading the medical education at ZL. And we can say that 90% of our residency program are running by alumni from ZL. So we try to implement that and to make what we learn into practice. And this is what we are saying right now. All professionals leading medical education and leading in the Ministry of Health as well, and leading in other hospital as medical director, executive director, or as any responsible CDC or other part of the country and health elsewhere as well. They are leading, and we got a lot of recognition for our practice and for our leadership from the army.
Thank you. No, you shared a lot of information in that. And just building upon that, speaking about our residents who are now working within our system, I recall, back in 2010 when the earthquake happened, there was obviously the lack of medical professionals. But in 2021, when the earthquake happened in the South, we had a lot of our residents going down to provide response efforts. And so it's just, a full circle moment of how important that investment in medical education is.
Exactly. We did have our emergency medicine resident going through that as well. And I have to add as well that there's other achievements that, like, for example, Vernet got a lot of like recognition, international recognition. We can talk about it. That's really proud. Um, and we can really, I can say that maybe Paul Farmer Williams is really part of what he did and what we have been doing so far.
Yeah, I guess that's a good segue into my next question. If you could reflect on some of the achievements that you're most proud of, obviously the awards that Dr. Vernet has received, that's definitely something to be proud of. But if you have any other examples that you'd like to share.
I can add though, because we have like Dr. Eliezer Dade in 2023. He was recognized as an ACP Global Physician Scholar, which is a significant international honor. He was the Associate Program Director of the Internal Medicine Residency. And we have actually Dr. Ensemble Charles. He's a former graduate of our Emergency Medicine Program. He's now serving as the Director of the Northern Department for the Ministry of Health. And we have also Eric Toussaint, who is the Medical Director at Hôpital Bienfaisance de Pillon. So these are just a few examples of our training programs of shaping national leaders in healthcare, and many of our alumni, like Dr. Sainterant, now hold leadership position within Zanmi Lasante.
Thank you for listening to the Sante Lakay podcast. Join us next week for another engaging conversation with an expert who is advancing public health in Haiti.